From KUOW 94.9 Seattle, I'm Ross Reynolds. The national debt is just over $14 trillion and growing by a rate of $4.5 billion a day. In the time it took me to read that last sentence, the debt went up by $312,000. Simply put, our federal government is spending much more than it's taking in through taxes. Now, the subject of what to do about it was addressed by a presidential commission. It's a hot topic in the other Washington. By far, the biggest part of the federal budget is entitlements, Social Security and Medicare, and defense spending. That's 63% of the 2010 federal budget. Now, some say it's time for massive cuts to get the deficit under control. They argue we're on an unsustainable path that's going to lead to astronomical debt. Mike Tanner is a senior fellow at the Cato Institute who sees the massive deficit as a top federal concern. Mike, thanks for joining us.
Well, it's a pleasure to be with you.
Others point to austerity programs in Britain and Greece that have only grown those countries' deficits. These critics argue that cutting won't help anything. You have to create a healthy economy, and the deficit will shrink as a result. Include among that number Randall Wray, an economics professor at the University of Missouri, Kansas City. Randall Wray, thank you for being with us.
Hi, Ross. Thanks.
Let's start out with Medicare and Medicaid, the federal programs that provide health insurance to seniors and low-income people. Randall Wray, do we need to start cutting from Medicare and Medicaid?
Well, can I just preface everything I'm going to say with my belief that the federal government, as our sovereign government, doesn't face a solvency, bankruptcy, or financing constraint. That doesn't mean that we are not spending too much on any of these individual programs because we might be devoting too much of our nation's resources to providing these things.
How about Medicare and Medicaid? Are we spending too much on those programs?
I think we are spending too much on medical care in the United States as a whole, almost 18% of GDP. That is very much more than any other competitive nation is devoting to health care. So I think we are devoting too much of our resources to health care.
Now, not all of that is Medicare and Medicaid, but a lot of it is. Should anything, do you think, be done to try to reduce the federal funding of those two programs?
I would reform the entire health care system. Medicare and Medicaid are about 23% of the government's budget, as you indicated. The federal government's share of total health care is about 27%. So the private firms are spending about 21% of the total health care budget, and it is also hurting them. The household share is 28%. It is also hurting them, so I would reform the whole thing.
Hey, I thought we did that. Didn't President Obama sign into law a bill to reform health insurance?
I think that what he did is he increased the insurance companies' share of health care spending. I think that the reform was a mistake.
Let's turn to the Cato Institute's Mike Tanner on this subject. Mike, from your perspective, is there a problem with the amount of spending we're making for Medicare and Medicaid?
Well, there is no doubt that Medicare is the largest portion of our unfunded liabilities going forward. The unfunded liabilities in the Medicare system are somewhere in excess of $90 trillion. Going forward, if you look at future obligations minus expected revenues for the system over an infinite horizon. So I think when you start talking about those kinds of dollars, you're talking real money by any measure.
How do you think the federal government should deal with these spiraling costs?
Well, I think you have to look at the total burden of government spending as a part of as a share of the economy. We're currently at the second highest point since World War II, but it's only going to get far worse going out from here. If you look to the current projections, unless there's some change, by 2050, federal government spending alone will consume 42% of GDP. That's 42 cents out of every dollar produced in this country would be consumed by the federal government.
Well, let's focus in on those portions of the federal budget that are Medicare and Medicaid. Giant amounts of money are being spent in those particular areas. How do you solve the problem of those rising costs?
Well, I think ultimately the only way to lower costs under health care is for someone to say no. And there's only two real entities that can tell people they're going to have less health care. One is the government can do it itself, some sort of imposed rationing, which I do not favor, Or the other alternative is to shift more of the cost back to individuals so that they can make a decision on the basis of the value versus the dollars they're going to spend. So under Medicare, what I would do ultimately is cap Medicare expenditures on a per capita basis to a fixed amount of dollars and return those dollars to individuals and let them make decisions on how they're going to spend that money.
Randall Wray, you just heard Mike Tanner say the real issue here is someone has to say no. Do you think that's right?
I think that what we need to do is to increase spending on the public provision of what are relatively cheap healthcare services that prevent people from getting sick. That is the best way to spend the money. That is what other nations do, and I think that in that way we could cut healthcare expenditure without rationing and without doing anything that is too extreme.
Let's turn to the subject of Social Security. The President's Debt Commission looked at Social Security. Some people don't think it should be included as a look at our high debt. What about you, Mike Tanner from the Cato Institute? Is Social Security contributing to the deficit?
Well, as a year ago, it would not have been. But this year, Social Security has begun running a deficit, and it will now run a deficit forever. It will never again go back into solvency. Now, it does have, in theory at least, funding through the Social Security Trust Fund, but the bonds in those trust funds have to be redeemed out of general revenues. The only way to pay the bonds back so that Social Security continues to pay benefits is to extract money from general revenues, about $57 billion this year. And in case you haven't noticed, we don't have $57 billion lying around. So the federal government is borrowing that $57 billion in order to repay the bonds in the trust fund in order to pay Social Security benefits. So in a sense, Social Security is contributing to the deficit today.
So how do we fix it?
Well, I think in the short term, $57 billion is, while it's still a lot of money, is nothing compared to what we're going to be paying in the out years. I think the thing is we have to look further ahead and tell younger workers, not today's retirees or near retirees, but younger workers, that the government is not going to provide the level of benefits that have been promised. We're going to have to cut that back. There's a variety of ways to do it. I think the best way is to simply change the formula that's used to determine Social Security benefits from a wage-based index to a price-based index.
Could you explain what that means?
Yeah, without getting into all the economics of it, when you calculate how someone's Social Security benefits are determined for what they're going to get in the future, we use their 35 highest years of earnings in terms of determining what their average pay was in order to determine those benefits. But we adjust it because what you earned 35 years ago is not worth the same amount of money as we earn today. Normally, when we adjust things, we use the inflation rate to determine that. But for Social Security, we go back and we determine the growth of wages over that same period, and that's faster than inflation. And what that means is that every year who retires actually gets higher inflation-adjusted benefits than the year that retired before them. I think we should just hold it constant for inflation. No one will get lower benefits than anyone the year before, but they shouldn't constantly be rising.
Economist Randall Wray, you heard Mike Tanner just sketch out the fact that the federal government has been borrowing from the Social Security Trust Fund, and